Last week, President Trump announced that the Affordable Care Act should be repealed and replaced with an alternative to be developed by GOP leaders, making it the latest move in the battle for better health care. Politics aside, data clearly shows that Americans have disproportionately high healthcare costs compared with the rest of the world. According to the Diabetes Council, the United States spends more than twice the amount of the average healthcare expenses compared with all OECD countries. And in 2017, Americans spent close to $3.5 trillion on healthcare alone. Now voters are looking for reforms. A CNN exit poll taken during the 2018 midterm elections showed that 4 in 10 voters think healthcare is the most important issue facing the country today. Here are the facts. Fact 1. There are a number of reasons why healthcare is more expensive in the U.S. than other countries. In addition to U.S. citizens paying more for the services, they also pay more for administrative costs due to the complexity of the country's healthcare system. Doctors in the U.S. also use more technology in their practices, including PET, CT, and MRI exams. The U.S. has 35 MRI machines for every million people, while France only has 8. Moreover, most U.S. providers make more money by performing more tests. This system inherently encourages doctors to treat more rather than being more conservative with their approaches. Fact 2. According to Bloomberg News, healthcare premiums, the monthly cost paid to an insurance company or health plan, continue to increase at a faster rate than both wages and inflation. Average family premiums have increased 55% in the past decade. This is outpacing workers' earnings, which have increased 26%, and inflation, which has increased 17% over the same period. Moreover, Bloomberg reports that in 2018, annual family premiums for employee-sponsored health insurance rose to an average of $19,616, marking the 7th year in a row that the cost of family premiums has increased. Fact 3. There are a number of blockbuster drugs in the U.S. that are exponentially more expensive than in the rest of the world. Humira, an injectable drug used to treat autoimmune diseases including rheumatoid arthritis and Crohn's disease, costs 3 times as much in the U.S. than it does in Switzerland. Harvoni, a medication to treat hepatitis C, costs $10,000 more in the U.S. than Europe. Avastin, a chemotherapy agent, costs 9 times more. Insulin, the life-saving medication for diabetics, costs $350 in the U.S., but only $50 in Canada. Fact 4. It's not just drugs that cost more. Diagnostic tools and surgeries do too. In the U.S., a routine MRI costs twice as much as it does in Switzerland, and an appendix removal in the U.S. costs $12,000 more than it does in Australia. Giving birth is also cheaper abroad. In the U.S., the average cost is close to $11,000, while in Germany it's just over $2,500. Fact 5. While many of these statistics are discouraging, there are some signs of progress. In September 2018, Politico reported that Medicare spending per patient is trending downwards, and many politicians on both sides of the aisle have committed to addressing some of the runaway costs that plague patients. Those are the facts. See you next time.